Gane, Sego, welcome once again, Six Nations. This is the podcast for May 12th, 2020. I hope everyone is well on this chilly Tuesday. For those of you just joining us, I'm Lori Davis-Hill, Director of Health Services and Incident Command for the Emergency Operations Group during the COVID-19 pandemic. We are bringing this podcast series to everyone to address the daily statistics of what's happening here and around our neighboring communities. We provide this as a source of wellness information with the hope that it provides you with a sense of relief from the stress and anxiety we are all experiencing during these murky, challenging, and very unique times. Speaking of wellness, let's turn to that area. For the past couple of days or so, I have mentioned that this week is National Nursing Week, May 11th to 17th. The week draws attention to nurses, increasing the awareness of the public, policymakers, and governments of the many contributions of nursing to the well-being of Canadians. There are many ways to celebrate, ranging from very small to grand, but I'm sure any of our local nurses will welcome even the smallest gestures, like just saying Yohs for all they do. Some other suggestions could be posting a picture with your nursing team on social media, and remember to tag National Nursing Week, support nurses and midwives, and Year of the Nurse. Be personal. Write thank you notes as a sign of your appreciation for all that your nursing staff and do for patients daily. Such gestures have become increasingly rare, so this simple act of recognition can make a profound difference in morale. Or if you want, you could buy a nurse a nice cup of coffee or tea to say thank you. Just remember to keep up physical distancing, as I'm sure they will be the first to remind you. Now I'd like to welcome one of our most valuable resources here at Six Nations during this pandemic response, Deborah Jonathanl. Hi, Deb. Tell us a bit about yourself, and thank you for joining us today.
Hi, Lori. My name is Deborah Jonathanl, and I'm the nurse in charge here at the Gane Health Center, which includes our primary care clinic, our public health department, and our laboratory department.
And how long have you been a nurse here at Six Nations?
I have been nursing a total of 24 years now in the profession. I started out in 1995, and I did a little bit of work in the hospital after I graduated. I came to the community shortly thereafter. I worked up until 1999 and then moved to Alberta, did nursing out there for a few years and moved back here in 2003. So I've been in this position at Gane since 2003 now.
Well, we're certainly lucky to have you. Can you tell us about National Nursing Week and how it came to be?
Yes. So in 1971, the International Council of Nursing designated May 12th, which is the birthday of our nursing pioneer, and that's Miss Florence Nightingale, as International Nurses Day. And then in 1985, the Canadian Nursing Association members passed a resolution to begin negotiations with our federal government to have the week containing May the 12th proclaimed as National Nurses Week annually. And then soon thereafter, the Federal Minister of Health proclaimed the second week of May as National Nurses Week. In 1993, the name was changed to National Nursing Week to emphasize the profession's accomplishments as a discipline.
That's really good information. What's special about this year's National Nursing Week?
So again, National Nursing Week 2020 is from May the 11th to the 17th. It always occurs from the Monday to the Sunday, again, of Florence Nightingale's birthday, which is May the 12th. And the theme for this year is Nurses, a Voice to Lead, Nursing the World to Health. And the theme was developed by the International Council of Nurses to showcase how nurses are central to addressing a wide range of health challenges. The International Council of Nurses says the theme will help raise the profile of the profession and attract a new generation into the nursing family. And actually, the World Health Organization, otherwise known as the WHO, has designated 2020 as the Year of the Nurse and Midwife in honor of the 200th anniversary of Florence Nightingale's birth. So the year 2020, as you know, has been a real challenge to healthcare systems globally, including nurses, with the arrival of the COVID-19 pandemic, which has shifted basically every facet of our lives. We would like to give a huge shout out and appreciation to all the nurses working tirelessly throughout this time, especially those who continue to serve our community. And we have many nurses working in our community today. They've been here right from the time that this pandemic began and continue to come to work every day. So these nurses include those working right here at Six Nations Health Services, the Gane Health Center, and Care Partners. So I'd like to thank you to all of them for all that they do for our community.
Certainly, we have to send the big meow and go out to all of them. And to you, Deb, we really appreciate all the leadership that you've shown us in this pandemic response, and that you continue to support us as we have to make decisions about how we will respond moving forward. So, meow, thank you for joining us.
No, thank you, Lori.
So we look forward to more celebration of Nurses Week in the next few days.
Yes.
I'd like to turn now to the numbers from here and the neighboring communities. Right now in Six Nations, we remain at 11 positive cases. 10 of those cases have resolved with 1 death, and we currently have no active cases. To date, we have completed 450 tests and have received 407 negative results. We currently have 46 people in self-isolation as directed by Oswego Public Health. Please continue to identify symptoms and get testing to help us monitor the impact of this virus on Six Nations. Here are today's statistics in surrounding communities. New Credit has reported 1 positive case. Alderman Norfolk Public Health Unit, 201 positive cases, 75 resolved, and 30 deaths. Grant Public Health Unit reporting 102 positive cases, 85 resolved cases, and 3 deaths. Hamilton Public Health Unit reporting 494 cases, 350 are resolved, and 24 deaths. And the Toronto Public Health Unit is reporting a total of 7,557 positive cases, 5,340 are resolved, and a total of 589 deaths. The province of Ontario is lifting restrictions on the retail sector of the economy. If you venture out to these retail settings, please continue to wear a mask and use hand sanitizer before and after going inside. Also, please continue the 6-foot physical distancing. Do not let ourselves be complacent. 1 positive case left unchecked can turn into a cluster, and our community could become a COVID catastrophe. If you are experiencing any one of the COVID-19 symptoms or any other new or unusual symptom, it is important that you call the Six Nations COVID-19 Assessment Center at 226-446-9909 or toll free at 1-855-977-7737. You can call the COVID-19 hotline anytime, 7 days a week.